You've probably seen videos hyping supplements that can shrink your prostate. And if you're here, you're curious. You want to believe there's a natural way to avoid medications or operations. Of course you do, anyone would. But you also don't want to throw money down the drain. And that's exactly why I went through all the big supplements myself. The ones from the health shops, the ones pushed by YouTube influencers, and the ones my patients bring to the clinic. So let's find out what works, what doesn't work, and let's see if I can give you 2 complete mind shifts on enlarged prostates. Because you might be asking the wrong question, and when I show it to you, it will make more sense. Prostate enlargement, or benign prostatic hyperplasia, BPH, is super common. By age 80, about 8 out of 10 men will have some degree of enlargement. And the symptoms, well, if you're here, you probably know them. A weak stream, struggling to go, struggling to empty your bladder, and of course going more often, especially overnight. So of course we wonder, are there natural supplements that can help shrink the prostate? First of all, you deserve the brutal truth, and then the silver lining. I could sit here and claim that Supplement X shrinks your prostate and quietly directs you to my online store. And some creators, doctors with hundreds of thousands of subscribers, literally do that. It would give you hope and it would give me money, but you deserve the truth. So here it is. No supplement has been reliably shown to shrink men's prostates. Not what you wanted to hear, but don't click away yet, because here is where the topic makes a complete turn. Here is what almost every man thinks. If my prostate is enlarged and that's causing symptoms, then shrinking it must be the solution. It's logical, yeah, but it's too tunnel visioned and it makes men chase the wrong target. Because whether it's supplements, lifestyle, drugs, operations, your real target should never be make my prostate smaller. Your real goal is make my symptoms better. And that distinction actually changes everything. Take the group of drugs alpha blockers, just as an example, like tamsulosin. These are the most common drugs for an enlarged prostate. But guess what? They don't shrink the prostate at all. Not one bit. But they work. Now let's go back to the supplements, not as prostate shrinkers, but as symptom improvers. This is the most famous prostate supplement, but does it actually work? Back in the day, tiny early studies showed that this supplement might help, and that led to it popping up in health shops and YouTubers pushing it. But when the bigger design trials rolled in, the truth hit hard. It performs no better than placebo. Some men do notice mild relief, but most see nothing. And here's the safety alert. Saw Palmetto can slightly reduce the levels of PSA in the blood, potentially masking and hiding the very early signs of cancer. It's unlikely to be significant, but it's still important in your decision-making process, and make sure you let your doctor know if you're taking it. Now this one is interesting. It doesn't shrink your prostate. Nada, not one bit, zero, zilch. But for some men, it does show improvement in symptoms. Better flow, less urgency, less dribbling, which proves the bigger point. You can get improvement in symptoms without shrinking the prostate. I've grouped these two together because they're often marketed in the same way. Promises about anti-inflammatory effects and hormone balancing. Some men do notice a slight improvement in their symptoms, but it's not consistent and the evidence is from small trials, so not useless. Pumpkin seed oil has some mild evidence for improving symptoms, possibly by reducing bladder irritation. And low zinc levels have been theorized to be associated with enlarged prostate symptoms, but the evidence says the opposite. Supplementing with zinc alone has not helped with symptoms. So if no supplement shrinks the prostate, and the supplements that help symptoms are mild and unreliable, does that mean there is no natural treatment for an enlarged prostate? Time for mind shift number 2. When we think natural, we think safe, healthy, no big pharma, natural supplements. But the supplement world is a multi-billion-pound industry with very little regulation. Some capsules don't contain what they claim, some contain more than they state, some are dangerous, and they're designed to make it look like you are choosing healthy. But the reality, the natural treatment options for an enlarged prostate don't come in a pill format, but they do come with evidence. The Mediterranean diet, which includes vegetables, nuts, olive oil, fish, these sort of good stuff, reduces inflammation, improves metabolic health, and in several studies, men with BPH had better urinary symptoms. Not instant, not flashy, but real. When I say exercise, I don't mean extreme gym routines, I just mean regular movement. Exercise reduces inflammation, improves bladder function, and lowers the risk of urinary retention. Honestly, if I could bottle exercise, put it in a pill, I would have the best-selling supplement of all time. The major triggers are alcohol, caffeine, and late-night fluids. These won't make the prostate bigger, but they can make the symptoms worse. So knowing and understanding your triggers, that's super important too. And these are the healthy options that might address the core problem, your symptoms and your quality of life. But there is something else you must not ignore. Before you even begin to focus on improving the symptoms, you need to understand why you have them in the first place. Yeah, BPH is super common, but prostate cancer is common too. So would you know the symptoms of prostate cancer, the signs it might give you? If you're not sure, have a look at this video here where I go through exactly that. Thank you very much for watching. I hope it was useful, and maybe I'll see you over there.